This is Dr. Burns from Burns Integrative Wellness Center wanting to talk to you about brain-body health. So what we do with that is for anyone who has generalized anxiety, we actually are using Spect brain scans to help pinpoint exactly where the anxiety may be coming from, because it's not just necessarily life experiences that bring the anxiety on. What happens is that our body chemistry ends up changing. So in order to help you be able to see and for us to be able to help pinpoint treatment, we do these brain Spect scans or Spect brain scans. And what they do is that they actually show the outside and the inside of your brain. As you can see from the clips that we have a couple of patients here. One of them has, or both of them have basal ganglia overactivity. What happens when the basal ganglia is overactive is that what brings on more worry and more anxiety. Well, normally under controlled conditions, the basal ganglia gives us a little bit of anxiety in order to help motivate us and move us forward. If it goes overboard because of life experiences, then that's when panic sets in, and also you just can't get out of that mode of thinking and you go to worst case scenario. And then from there, your brain ends up getting locked in place from a place called the cingulate gyrate, and that'll also show up on the scans as well. Your cingulate gyrate is supposed to help you move from one thought to another, but if it gets stuck in one position, that worry is going to go even higher, which then ends up creating, guess what? You've got it, another cascade with the brain called the limbic system, which ends up causing the depression. So a lot of times for people who have generalized anxiety, memory goes down. So we got temporal lobe involvement along with those basal ganglia, which here again creates all that anxiety and stuff like that going on, and you're stuck. Just even if you're seeing your therapist, you are just physically stuck thinking about that if anything triggers the anxiety or if it just comes up out of nowhere. So there's other things that happen in the body besides the basal ganglia going off. Basal ganglia, when you got the anxiety, can also give you cold sweats and hot sweats. Here again, insomnia and also pain as well as part of that when that basal ganglia goes up. And so what happens is your adrenals start pumping more cortisol. Your body goes into flight or fight response, so it tries to shut down thyroid, eating, your gut system with digestion, and also your hormones. So you're awake at night, which doesn't help because those adrenals are pumping a whole bunch of cortisol. You're really tired during the day. Any little thing ends up setting you off. So what we do here is not only do we look at the brain, we also look at nutrition, we look at adrenals, and we look to see what's going on with your hormones, testosterone, estrogen, progesterone, DHEA, all your other precursors, thyroid function as well. Stress is a real thing. What happens with it, you can literally burn out an organ from stress. I've seen people burn out their thyroid, their pancreas, their adrenals because of this type of stress that keeps going. So we do this in collaboration with your therapist. We can try to balance out your body chemistry, try and retarget maybe some supplements or prescription medications to try and bring that anxiety down. So in that way you can work with your therapist in actually getting in with the tools and start using them instead of starting to get anxiety and not remembering the tools that your therapist has been trying to help you with. So I strongly suggest coming in and seeing us because yes, we can actually heal the brain. We can reverse a lot of this stuff. We work really well with the therapies that you're getting from your therapist in order to help you out. Now, is it a quick fix? Absolutely not. Sometimes it takes about a year, or 6 months, or maybe a year and a half in order to get your body chemistry straightened out, just because stress will really turn it one way or another. So you got to give us time, and you also have to give yourself time. So come in and see us today for the benefits of it. We really have a lot of people that we've been able to help, and we have before and afters to show how the brain can actually heal if we can get the body chemistry balanced out right, and also for you doing your therapy as well. Having questions, definitely give us a call and we can help you out. Thank you.